try and add some more clarity to what is confusing Class 1, Class 2, Class 3, A&E as positions. So I focus my questions on that. Is it of any concern to you that there could be confusion with these different classifications of A&E, and that could have detrimental outcomes on people, particularly people who self-apply to the A&E?
Cheers, Farm.
So yes, of course it would be a concern if we were giving confusing messages to the public, which is, I think, why Bruce Cllr is doing what he's doing, so that we're all clear and we've all got one understanding about the issue.
Not halfway through.
So that's very good, because you weren't concerned about that last time, as a group of people. I can't remember what your answer was, but you got your thing on. Thank you. You weren't concerned about this. So essentially, so Bruce Cllr has been sent away and told to do his homework again, because there is evident confusion. Having come up with this ridiculous Class 1, Class 2 and Class 3 A&E, he's now being told to go and clarify it. So essentially he's having to go and do that. But you're now saying that the room for that is the type of catastrophe sort of Chalk Farm, where that misunderstanding led to the horrible consequences that we saw there. You're now accepting that publicly, are you?
What I'm saying is that it's a very good idea that Bruce Cllr is going to provide us all with the specification to which we can work. I think that's self-evident and a good thing, and I welcome the fact that Bruce is going to produce that specification.
But you're also accepting that difference in the definitions 1, 2 and 3 has caused confusion to date by the nature of your answer and what you said earlier, which I appreciate we're filming. And that confusion, certainly in the case of Chalk Farm, did have horrible consequences, and that a potential for that again putting lives at risk.
What I said was that...
No, I'm not asking you what you said, because we can all hear it, we can watch it back on video. I'm asking you to answer the question I just asked you. Has it put lives at risk?
What I said was that it's a very good idea that we have clarity, and it's a bad thing if ever we confuse the public about the services that we provide. So I do think it's a very good thing that Bruce is producing the specification that he's been asked to produce.
Yeah. Now this is a Policy and Accountability Committee, and with the greatest respect I'd ask you to answer the question, and I'm directly asking you not to repeat the previous answer. The question I'm asking you, has this confusion around Class 1, 2 and 3 A&Es put lives at risk? It's a straight yes or no. So it's not a repetition. The answer you've already given us 3 times.
So I'm not aware of any lives being put at risk as a result of what you're suggesting at all, no.
Okay. Anybody else who's medically qualified, does this confusion put lives at risk? Dr. Spicer.
So I'm not aware of anybody who's had their lives put at risk because of this, but I would like clarity about it.
You don't think Chalk Farm is an indication of that? Chase Farm.
Am I allowed to help? Answer?
Well, I'd like a medical opinion first. We can come back to you in a minute, Daniel.
So I don't have a medical opinion about whether the categories affected that particular situation.
So the situation was someone went to the wrong hospital because they thought it was an A&E, but it was an urgent care clinic, and then that the consequences of that, as you are extremely well reported, it put a life at risk. And therefore, you could deduce from that, and it's not complicated to do that deduction, that it's happening there, this misunderstanding around Class 1, 2 and 3 A&E, which is a ridiculous definition and should now be put together for political rather than clinical reasons, that Class 1, 2 and 3 A&E has been a catastrophe, which is why Bruce Cllr is having to do his own work again and try and fix that. It's put lives at risk, surely. The evidence says it, doesn't it?
So I think, Councillor Cowan, we've got 2 things confused here. So type 1, 2 and 3 is a kind of internal NHS classification of different kinds of A&E. And it's not used to advertise to the public. You don't say that St Mary's is a type 1 and the Western Eye is a type 2 and Hammersmith is a type 3, even though that's what they are in the technical definitions that we have. And that's different to what happened at Chase Farm. So what happened at Chase Farm was that, as you say, someone did go to a hospital, and the issue was that the urgent care centre wasn't open. And it wasn't, and if the urgent care centre had been open, then the person is much more likely to have had a better outcome. And the learning that we have taken in North West London was that all our urgent care centres need to be open 24 hours a day, 7 days a week, so that there are trained senior clinicians on site. And so there isn't the patient footfall to need Hammersmith urgent care centre to be open at 2 o'clock in the morning. But we took the decision that to avoid the issue you are raising, it's in the interest of patient safety that it is open 24 hours a day, 7 days a week.
Okay, and that's going off track a little bit, so I'll come back to it. So back in January, it was reported that a 2-year-old child died after her mum rushed them to Chase Farm Hospital in Enfield and hadn't realised that A&E had closed. And as a consequence, that life had been put at risk because it was now an urgent care clinic or was closed, as you quite rightly say. So what we see in that one instance, not only a life put at risk, but a life ended because of NHS confusion and Sir Bruce Keogh's inability and the politicians behind it, inability to get this right in the first place. So now this definition is needing to be done again. And I'm saying to you, are you happy to confirm that this is an urgent piece of work because at the moment it is putting lives at risk?
So we can't talk for Bruce Keogh and the national policy merger that is going on because we do the local NHS, as you know. Our learning that we took when we were thinking about the urgent care centres in North West London was the best way of minimising patient risk and having the most safe system we could have is to ensure that the services that we have that say they provide urgent and emergency care are open 24 hours a day, staffed by senior clinicians.
So let's move on, because I think we've got the answer by osmosis in terms of what you didn't say. So it's without doubt, it has got lives at risk. In terms of what's going to be at Charing Cross Hospital, have I understood Dr. Spicer's answer properly? He's arguing that it should be a urgent care clinic by the definitions, or else that's what he's essentially arguing.
No, I didn't say that.
In what way is it going to fit a Class 1 definition of an A&E?
I didn't say that it would fit a Class 1 definition of an A&E.
What do you think it will fit?